Hello, my name is Mariah Peterson, and I will be providing a one-slide presentation on human trafficking. So, human trafficking is very prevalent in our world today. In the United States alone, there's 50,000 human trafficking victims, with 92% of them being females and 52% of them being children. The most common state is California for this to occur. Most common place of presentation where these victims are actually or can be brought to is the emergency room, and therefore it's important for providers to be able to recognize the signs because it is a mandatory reporting offense. Oftentimes they present for abdominal pain, pelvic pain. They will present sometimes disheveled or altered due to drug use. And oftentimes they can also appear as normal, but you can just tell that something might just be off. So the key to screening and examining them is to separate them from the trafficker. That has to be done in order to complete a full assessment, and that full assessment is going to ensure that they're in a gown and you're examining their skin and any other complaints that they may have. Management, as a provider, you're going to ensure that they have the resources that they need, a safe place, and medication management for anxiety, preferably SSRIs. Oftentimes, if these victims are over 18, they will not want help and they will want to stay with the trafficker. And this is known as Stockholm Syndrome. Understand that the victim's family may be at risk, and just keep that in mind, as oftentimes the trafficker will tell them, well, if you don't do this, I'm going to kill your family or I'm going to kill your child. So it's important to think about. Role of the provider as in prevention, so just making sure that at your visits, routine visits in the family practice clinic, that you're assessing the home environment, family relationships, work, all those things, and assess for changes as well. And the Christian worldview, so always ensuring that you're approaching these victims with compassion and standing up for them. We're called to stand up for the weak and the oppressed, and so just keeping that at the forefront of all of this. So thank you.